I'm going to tell you a crazy story about my longest operation ever. I'm an orthopedic surgeon, and at the time I was working in New York City. Many years ago, when I was working at this hospital, you would see some of the craziest trauma. It was very early in the morning when I received a phone call from the emergency department with a young kid who was in very bad shape. He was initially stabilized the best we could, and he received a lot of blood. And then he went for diagnostic imaging to see what was broken and what was wrong with him. We weren't sure exactly what the cause of trauma was, but we ordered a jumper series on him. And what that is a bunch of diagnostic x-rays to see what's broken. Well, it turns out this kid broke most of the bones on one half of the side of his body. He broke his cervical spine, his humeral head, his humerus. He dislocated and broke his elbow, broke his distal radius, dislocated one of his carpal bones called the lunate, and then also broke 3 metacarpals, and that's just the upper extremity. He also broke his pelvis, which is called an open book pelvis, which you bleed a lot from, and he also broke his femur and his tibia on that side. And the reason this happened was he actually got robbed and someone threw him off a 5-story building. Luckily, he survived, but if you don't go to the operating room and stabilize the fractures, it can cause a lot of problems and even mortality. In the operating room, we put something called an external fixator on both his pelvis, his tibia, and his femur. This is called damage control orthopedics, where you're just trying to stabilize the bone but not fix it definitively. His cervical spine was treated in a collar, so no surgery there, but we fixed his humerus, his humeral head. We put his elbow back in place and fixed that. We fixed the wrist. We put the lunate bone, which is a carpal bone, back in place and fixed his metacarpals. All in all, this surgery took about 16 hours. He then went to the surgical ICU, and a few days later we brought him back to the OR to definitively put plates and screws and a nail in his pelvis, femur, and tibia, and that was a 12-hour surgery.